This nasal spray is used to help with seasonal allergy symptoms in the nose, like stuffy or runny nose, itching, sneezing, and post-nasal drip. It has 2 drugs in it. Olopatadine is an antihistamine that stops certain natural substances, called histamines, from causing allergic symptoms. Mometasone is a corticosteroid that reduces swelling in the nasal passages. It's recommended to use this nasal spray at the same time every day for the best results. Before you start using olopatadine/mometasone, make sure to read the patient information leaflet from your pharmacist. Use this medication in the nose as directed by your doctor, usually twice a day in both nostrils. Do not spray in the eyes or mouth. Gently blow your nose before using this drug and shake the container well before each use. Remember to use the spray at the same times each day to get the most benefit from it. Don't increase your dose or use it more often than prescribed. Keep track of the number of sprays used from the container and discard the container after you have used the number of sprays specified on the manufacturer's package. You may feel the product start to work as soon as 15 minutes after the first dose, but it may take several weeks before you get the full benefit of this product. Tell your doctor if you do not get better or if you get worse. Some possible side effects of olopatadine-mometasone nasal spray may include a bitter taste in the mouth, nosebleeds, or irritation/soreness in the nose. Drowsiness may rarely occur. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefit to you outweighs the potential risk of side effects. Many people who use this medication do not experience serious side effects. Be sure to notify your doctor right away if you experience any serious side effects, such as pain/sores in your nose, white patches in your nose or mouth, or painful swallowing/trouble swallowing. In rare cases, corticosteroids given in the nose may be absorbed into the bloodstream, which can lead to side effects of too much corticosteroid. These side effects are more likely in children and people who use this medication for a long time and in high doses. If you experience unusual or extreme tiredness, weight loss, headache, swelling ankles/feet, increased thirst/urination, or vision problems, it's important to inform your doctor immediately. Although very rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can call your doctor for medical advice about side effects, or you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, call your doctor for medical advice about side effects, or you may report side effects to Health Canada at 1-866-234-2345. Before using olopatadine 665 Mcg-Mometasone 25 mcg/spray nasal spray, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues. Also, let your doctor or pharmacist know about your medical history, especially if you have had eye problems, infections, or recent nose problems. This information will help them determine if this medication is suitable for you. Keep in mind that this medication may rarely cause drowsiness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you know how this medication affects you. Be cautious around individuals with contagious infections, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection or have any concerns, talk to your doctor for more information. Using corticosteroid medications for a long time may make it harder for your body to respond to physical stress. If you are scheduled for surgery or emergency treatment, or if you experience a serious illness or injury, be sure to inform your doctor or dentist that you are using or have recently used this medication. If this medication is used for a long time in children, it may temporarily slow down their growth. It's important to monitor your child's height regularly by seeing the doctor. If you are pregnant, use this medication only if it is clearly needed and discuss the risks and benefits with your doctor. Additionally, consult your doctor before using this medication while breastfeeding to ensure the safety of your baby. It's important to be aware of potential drug interactions that could affect how Olopatadine 665 Mcg-Mometasone 25 Mcg/spray nasal spray works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medications, always consult with your doctor. If you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines, inform your doctor or pharmacist. Also, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, ask your pharmacist about using those products safely. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Remember, it's important not to share this medication with others. If you use this medication for an extended period, your healthcare provider may schedule lab and/or medical tests to monitor your progress. These tests may include nose exams and height measurements for children. Be sure to attend all scheduled medical and lab appointments. It's best to avoid substances that could worsen breathing problems, such as smoke, pollen, pet dander, dust, and mold. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at your regular time. Do not take a double dose to make up for the missed one. It's important to store this nasal spray upright at room temperature, away from light and moisture. Avoid storing it in the bathroom, and do not freeze or refrigerate it. Keep all medications out of reach of children and pets. When it comes to getting rid of this nasal spray, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's best to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.